presentation. But like I said, we're going to start at 6. It's 6 on the dot now. So my name is Amanda. I am the lead dietitian working with Christina at the practice Functional Nutrition RX. So welcome to tonight's presentation. It's going to be a two-part presentation. So of course, the title is Foundations for Resilient Health, Blood Sugar, Medications, and You. So part one today is laying the foundation about general blood sugar health for really anybody modern day, whether you have a family history of diabetes, current diagnosis of diabetes, pre-diabetes, or you just want to learn how to better stabilize your blood sugars to optimize your energy throughout the day. It's really meant for everybody because everybody eats. So we're going to lay the foundation on blood sugars today and food support. And then in 2 weeks, we'll start part two at 6 o'clock on the 28th of July, going more into what are the GLP, GIP medications, the side effects, nutritionally managing those side effects, and then, of course, navigating those medications and healthy lifestyle change. So without further ado, I gave a little overview of what we're going to cover today, but specifically, we're going to go more into a little bit of the science heavy portion at first. So I promise you guys we're going to get right through that, but I think a lot of us really want to understand that mechanistic knowledge of what's going on from a root cause level in our body. So it's going to be a little science heavy at first, and then we're going to go into the general, more of like a medical background of nutrition relating to diabetes, like measuring your blood sugars, who should measure their blood sugars, different laboratory measures that can help, dictate your dietary changes or other lifestyle changes. And then, of course, we'll move more into food, supplementation, and any, questions you can ask throughout. Or, of course, at the end, we will also have a Q&A. So without further ado, what does blood sugar really mean, right? So when you think of carbohydrates, glucose is the smallest unit that a carbohydrate is going to break down to. So most carbohydrates you eat break down to glucose, including wonderful foods like fruits, parts of vegetables, whole grains, beans and legumes, and even parts of other foods too. So like some nuts and seeds or nut butters, right? Have little bits of carbs in them. Blood sugars are also called glucose, so I'm going to use that term like a synonym throughout today's presentation. So blood sugar or blood glucose, glucose, sugar go hand in hand. Primary source of energy in the body is glucose. So of course, fat is broken down to glucose to then be utilized in the body. So it is one of the smallest units of, food that can be broken down and extracted and made into ATP. Blood sugar transports, your blood transports glucose to all your body's cells, as all your body's cells need to utilize glucose or ATP for energy. And diabetes is a condition in which your blood sugars rise abnormally high due to maybe an imbalance with different hormones, including insulin or glucagon, and the body is typically insulin resistant, especially when we're speaking more about type 2. Today's presentation, we will touch a bit on type 1, but is mostly geared towards a type 2 insulin resistance mechanism. You can also see on the bottom other ways that carbs break down. So sucrose, your basic table sugar, actually breaks down to glucose and fructose further in the body. So next, what is the mechanism of insulin resistance, right? So your pancreas has beta cells and alpha cells. Your beta cells produce insulin in the body. So when your body is expecting carbohydrates or there is blood sugar in your bloodstream, and you want to utilize that sugar to make energy, your pancreas releases insulin. Insulin is going to act like a little key, and the cell, of course, has a lock in it, right? We want to be a little picky about what we let into and out of our cells. So insulin has a specific key that can unlock the receptor in the cell to allow the sugar to cross over that border into the cell to then be used to make ATP or energy, right? The basic unit that we move our bodies and, live each day with. So with insulin resistance, it's like as if someone changed the lock and insulin doesn't really know yet. So we're using the wrong key to unlock the cell. So what happens is The body wants to utilize more insulin to try to open up these receptors. The pancreas starts to produce more and more and more insulin to unlock these receptors, which finally help to get it, open. So the pancreas eventually does get tired sometimes. And when it gets tired, you start to see those beta cells start to atrophy or die out, and you see a reduction in the amount of insulin produced in the body. So that's when the person's moving from more of a type 2 mechanism where the receptors, it's not really unlocking, to where type 1 is now the pancreas is really tired. It's not able to really make insulin. So now the insulin resistance may have progressed to a further point that now the individual might need to be on insulin. So this can, of course, take place over a very long period of time in our bodies. So someone can start, early signs of insulin resistance in their 30s and may not see, a diagnosis of prediabetes until their 60s. It's something small that can creep up over time, which is wonderful because we can test for it, we can try to get ahead on things, and we can make lifestyle changes as needed depending on our current lifestyle status. So if anyone has questions, please let me know. So now we're getting into more just laying the land, getting the vocab. What is prediabetes? It's a condition in which your blood sugar levels are greater than normal, but not within levels of diabetes. 1 in 3 Americans currently do not know they have prediabetes. So that's a big reason why we like to give this presentation, because it's a conversation, whether it causes you yourself to go out and get tested if you have not already, or you talk about it openly with others. Did you know that 1 in 3 people don't know? You never know who you could be helping to just go get that checked. It takes 5 seconds to go get your glucose checked. You could go to, your local primary care physician, your, of course, pharmacy, etc. But we're going to go more into proper testing for prediabetes. So typically what's done nowadays is the hemoglobin A1C. It's a 3-month average of your blood sugars. So it's your blood sugars all throughout the day. It's not just an average of your fasting, but just what you're walking around with all throughout the 3 months. Someone with prediabetes has an A1C of 5.7 to 6.4. So that would be the range of prediabetes. Often, how it's first kind of picked up could be that the fasting blood sugars on your basic blood work with your primary care physician typically starts to creep up above 100. Functionally, so there's a difference with functional interpretation of labs versus your classic westernized interpretation. Westernized interpretation is, either free of disease or has disease, right? Functional is looking at it from a tighter range, saying what is ideal functioning of the body. So from a westernized perspective, over 100, 101, 102 should be warranting to have an A1C if not done already, and signs that something's going on from an insulin resistance standpoint or something else. From a functional standpoint, if you're seeing your blood sugars, 99, 98, 95 and above, and when you're testing, you're fasting, of course, as I said earlier, which specifically is about 8 to 10 hours without food. You can have water, however. If you're starting to see that creep up, it should prompt, maybe wanting to check your fasting insulin or your hemoglobin A1C, especially if when you had those sugars tested, you weren't sick with like a cold or some kind of a wound, because it's important to note that blood sugar doesn't just creep up because of carbs we eat. It creeps up sometimes because of just different stressors on the body. So you do want to see glucose as almost like a barometer of stress on the body. So if I'm sick with a cold, my blood sugars are going to be a little high for what's high for me. Or if I have a really bad, wound on my leg, I don't know what happened, but that would cause my blood sugars to go high for what's high for me. And even stress, physical or mental, right, can affect our blood sugars, which we're going to get more into cortisol and blood sugar management down the road today too. So prediabetes, we want to get cells to respond to your pancreas and produce more insulin. So sometimes if someone does have prediabetes, the doctor might start early intervention medications. We'll touch a little bit more about that. But often with prediabetes, many of the providers now are often giving, I see my patients 3 months to 6 months, based on other comorbid conditions, to focus on lifestyle before medications are brought up. What is diabetes? So, like we said, diabetes is a chronic health condition, chronic meaning greater than 3 months occurring, and affects how your whole body turns food into energy. It can occur when your pancreas is not creating enough insulin or your body is not efficiently using insulin, like we were saying, insulin resistance. The keys to unlock the cell, the locks are getting changed. We can't get into the cell to give the cell the glucose it needs. So we keep the glucose piling up, piling up, piling up to the point where the A1C is now starting to creep up above 6.5 and above, right? So 6.5 and above is considered criteria enough for diabetes, right? But of course, if you're looking at just fasting blood sugars, we're looking at a fasting blood sugar above about 124. So pre-diabetes is above 100 to 124. Diabetes is 125 and above, specifically referencing fasted glucose. So, other ways that people will have, of course, diabetes is not just type 2, there's type 1. So, type 1 is considered an autoimmune condition for some. I mean, usually you see it as juvenile diabetes, is what it's called. That's an old term, as we're seeing type 2 diabetes now in younger ages, but also the body attacking the beta cells of the pancreas can also occur at later ages. I've had a handful of patients come down with different conditions, including oddly COVID. Actually, it was a genetic trait where the son got COVID and it attacked the beta cells of his pancreas. And he developed type 1 diabetes within almost a week. It was very scary. The same thing happened for his father, who ended up coming in as my patient, and it attacked his beta cells. And overnight, he had good knowledge because he had helped his son, and it attacked his beta cells. So it was deemed it was just a genetic fluke thing to have happened. But you can see autoimmune issues arise in different ways, where the body inappropriately attacks the beta cells of the pancreas. But it's usually diagnosed at young ages, most of the time. Um, Unless someone is already a type 2 diabetic, which is the most common form. And as we explained, their insulin resistance just progresses to a point where that pancreas is just getting so tired, churning out, churning out, churning out insulin that they just start to, sput out, and the cells start to atrophy and die off. And then the pancreas can no longer really support that insulin. So that's where a type 2 diabetic can progress to somewhat like a type 1 and needing to utilize insulin. Gestational diabetes is important to talk about. So it occurs only during pregnancy, and it can increase risk of developing type 2 diabetes later in life. That's that oral glucose tolerance test that all women who are pregnant working with their provider take to screen for gestational diabetes. And then you might hear a little bit about type 3 on the rise, which is in older adults. It's just a different nomenclature. It's just people who are typically diagnosed as type 2 progress to a type 1 as truly what's called like type 3, which is we get older as over time. Just with age, the beta cells are atrophying and causing that decline. And it's also considered just to be more related to individuals above the age of like 75, I believe. Prediabetes, we already went a bunch into. So we're going to go forward. Ooh, perfect. So what is diabetes type 2? We went already more in depth in that, but this is just a great slide to reference, especially the risk factors. So it can, someone with type 2 diabetes, of course, having prediabetes is a risk factor. Having a BMI greater than 25, the higher the BMI, typically the greater the risk for diabetes. However, when you're thinking about BMI, a more modern take on that is looking at waist circumference, essentially visceral fat, right? So for measuring our waist circumference, and we're starting to see that for a male, it's over 40, female over 35. That's putting us at a greater risk for metabolic syndrome and indicating a likely higher amount of visceral fat around the organs. So visceral fat's thought to stress the organs, and therefore, because the organs are more stressed, we touched that blood sugars are a barometer for stress on the body. Therefore, you're at a greater risk for elevated blood sugars. If you have a higher BMI, waist circumference, visceral fat, just more stress on the body when we have more body fat. But I think something that isn't listed here is if we're under muscular too, right? So muscle is a metabolic motor to help burn sugar. The more muscle you have, the more sugar you're burning just sitting here, listening to the presentation. So it's not just, I hate to phrase it this way, over fat, but it's under muscle too. 45 years or older increases risk. Family history, of course. So sometimes is it nature versus nurture? There's genetic, but then also the genetics, but also the environments that we're conditioned to, have our lifestyle in. Sedentary lifestyle, and certain backgrounds, certain ethnicities are more prone than others. And like I said earlier, below you could see the laboratory values to consider. A 2-hour postprandial glucose just means 2 hours after eating. So if it's over 200, 2 hours after eating, or after a 75-gram oral glucose load to test. So that's similar to what you do for gestational diabetes. We already went a bunch into the A1C, but this is just a great slide that, breaks it down further. But like I said, it's a 3-month average of your blood sugar. If you're looking from a functional standpoint, right, you're a healthy individual that you're just trying to learn a little bit more about blood sugars to optimize your energy and maybe help to control, the waist circumference a bit, or more so just most importantly, prevent onset, right? A functional consideration is to have like your A1C under 5.2 or 5. 5.3 tends to be the range. It's a looser range. So I usually say 5.3 and above to my patients. I'm pretty happy, but I've seen some stricter functional clinicians wanting it under 5. I think that's um, a little, a little difficult to obtain. I think under 5.3 is a really great place. But like we said, pre-diabetes is greater than 5.7. So at the end of the day, if you're 5.6 and below, you're in a better spot. But let's just try to get it 5.3, 5.2 if we're really trying to be in an ideal place. Nothing's wrong with 5.5, for example, though, really. It's just if you're trying to reduce your risk as much as possible. Or certain goals, physique-wise, it depends. So when someone's first getting diagnosed with prediabetes, diabetes especially, the provider often is going to want to recommend lifestyle modifications in the modern day. You want to typically, what I see in practice is the provider, depending on how high the A1C is or how long they've already been trying to counsel the patient to focus on lifestyle, they'll typically give at least 3 to 6 months when I first see that the A1C is popping above 5.7 to about 7%. Typically, what's done is monotherapy, meaning one medication like metformin or a GLP medication. It's typically intervened at least at an A1C less than 9. Plus, lifestyle modifications you're always going to encourage throughout. So once the A1C is starting to go above 9%, the provider might recommend, dual medications like, say, a metformin and another medication to support the kidneys. It depends on what's going on with the person, but these are just typical guidelines that you might see. Of course, the pharmacist can go much more in depth than I can in this. If the A1C, though, is starting to be above a 10, 11, a 12%, lifestyle modifications are, of course, recommended, but it would be very problematic to have the person walk away without any medication, unfortunately. So typically, insulin or some kind of combined injectable, so insulin with other medications, is recommended until that person gets that A1C low enough, typically below about 8%, where they might be working with their doctor based on their level of compliance and their body's ability to regulate to maybe come off that insulin. So some people do think being on insulin is be all end all. Sometimes it's not. So it is about working with your provider and if you do want to focus on lifestyle modification, letting them know that that's what you're also interested in, so they could work with you with your, medication needs if you do have needs. The difference between type 1, type 2, we already went a little more in depth in this, but this is just a great visual if you really want to dive deeper into this. We are going to send out the slides after today with the presentation as well. as I do have a tendency to go a little over, guys. So, of course, if anyone has to hop off and then go back on and listen to it again another time, or, maybe you want to play something back, maybe I said it kind of funny, or, you want some greater clarity on it, that's where the recording also comes in. It's really nice. But stop me if you have any questions. I write, why should I care, right? Why do I care that my blood sugars are going high? What does this mean for my body? What is this doing to my body? From a cardiovascular standpoint, heart disease is one of the major killers of Americans. Heart disease is not often a solo player, though. So you often see heart disease coinciding with elevated blood sugars. So you want to think about all these conditions as coexisting conditions. So if someone has sugar in their bloodstream and it's starting to accumulate higher and higher and higher and higher, it's going to increase the incidence of these they're like a glass-like, think like a glass like crystal-like particle sugar, right? We've all seen sugar granules before, floating through the bloodstream, and picture that just like rifting up against the blood vessel walls, right? Now you have hypertension, right? Like say I have hypertension. Now I have a greater force pushing that crystal-like molecule through my blood vessels, right? So that might cause little scraping, think like a little cut. That might cause my immune system to become a little hyperactive, send some macrophages out to that site. There's some inflammation there, some redness. Think of when you cut, you fall and you scrape your elbow, right? That redness, that heat, that's inflammation. So that sugar causes that scraping, causes that immune system activation. And then if someone has heart disease and elevated, cholesterol, fatty particles in the bloodstream, that's circulating, that might get stuck in different places depending on the nature of that cholesterol and gets stuck in with that immune modulation and creates this atherosclerosis, especially with the heat and that hardening of the blood vessel walls. So in summary, you kind of think of it like caramel. You have three sides of the triangle. You've got heat, which is inflammation. You got lipids, which is cholesterol or like the butter when you're making caramel. And then you have the sugar when you're making caramel, aka the blood sugar. When you combine that all together and it kind of sets, right, it creates that hardening, right, that sticky texture. So when you think of all of this kind of coinciding together, elevated blood sugars by itself, yeah, it could be problematic, but it's if someone has high blood pressure, someone has elevated lipids, someone has high inflammation, maybe they have autoimmune disease, there it creates a bigger issue upon itself. So that's where the link part with cardiovascular disease and blood sugars go hand in hand, one of the number one killers of Americans. So that's how that happens. Retinopathy, like I said, sugar is like a little crystal molecule, so it gets into these little spaces in our blood vessels, so it can, damage that tissue. So it gets into the vascular tissue of the eyes, the kidneys, nephropathy, peripheral neuropathy, autonomic neuropathy, so it affects the nerves. And then, of course, you also want to think of cognitive decline. You have blood vessels in your brain just as well. That sugar can travel through the blood vessels there. Of course, it's linked with inflammation. So cognitive decline is in part considered like a chronic inflammatory condition linked with better benefits following like a MIND diet or anti-inflammatory diet, aka one that balances blood sugars as well. So it all kind of comes hand in hand. So you want to just think of sugar as this pesky molecule just getting into spaces and causing damage that we just don't want it to do. How is the treatment, how is the specific treatment for diabetes determined? Like I was saying, everyone's unique, right? We all maybe carry weight a little differently. We all have different genetic background. We all eat a little differently. We all have different disease conditions or ailments that maybe bother us. So the doctor's going to want to look at, and your healthcare team in general, everybody on the team should kind of be thinking about what's going on with my patient. Is there cardiovascular risk factors going on? Is there hypertension going on? Is there a cost access to food? What's the knowledge level? What's the motivation level? What's the individual's treatment needs to put these pieces together to figure out, what you're going to do. Typically, a provider should be working with you as like a teammate. It's not what's that parental dynamic of, I'm telling you what to do. There should be some kind of a team discussion of getting to know you as a person and also your wants and needs. I feel like a lot of individuals sometimes tell me their provider was really quick to jump to the medication because they might have assumed, something about their diet, or their doctor actually really took the time to sit and ask what they were eating, how they were sleeping, how their stress was. It's a deeper conversation than just your blood sugar is this, take this medication. Um, and the ominous octet is a piece that goes into this. So ignore that it says biguanides. That's just a medication class for, say, like a metformin, right? But I wanted to highlight the ominous octet. So it's 8 different mechanisms. So it's a really cool diagram to show this, in which someone's blood sugars might be having issues. So we see decrease incretin effect. That word incretin might look familiar. It's a very hot word right now because of the GLP, GIP medications. They help your gut to make more incretin hormones, so more of the bacteria that makes incretin hormones, which then travel up to the brain to say, hey, I'm full, I've had enough carbs, slow down on those cravings a little bit. We don't need that. Send a message to the brain, tell them to stop craving, these carbs, right? So that's where the gut comes into play, getting plenty of fiber, having a healthy gut flora of diverse, healthy bacteria to help make those incretin hormones. You also see impaired insulin secretion, right? We've talked about that. Insulin helps to lower blood sugars because it helps to unlock the cell to let the sugar enter the cell to make energy. So if there's impaired amount of insulin in the body, we're going to have an issue. For some, they have issues in what's called their alpha cells. So that's another set of cells on your pancreas that make glucagon. Glucagon is the opposite of insulin. So insulin brings sugars down. Glucagon's there to save the day if your sugars are not high enough to, help bring you up. Hepatic glucose production is the liver very stressed? Do we have fatty liver disease or cirrhosis going on? Is it impacting how much sugar is being filtered by the liver and released? Neurotransmitter dysfunction, is there maybe depression going on? Other conditions going on that can drive food, ghrelin, leptin imbalances. You see here decreased glucose uptake that's a muscle fragment. So we were talking about too much adipose or fat tissue. I like saying adipose tissue, honestly. It's just a nicer term. Too much adipose tissue, but what's not talked about is not enough muscle. So a lot of people like to be like, Amanda, my husband started making nutritional changes and he lost weight so fast and da da da. Or his metabolism so fast he could eat as much as he wants. Why do men have this? Men have more, typically men have more testosterone. Typically, more testosterone leads to higher muscle mass. The more muscle you have, the more calories you're burning just to sustain that tissue to keep yourself alive. The more muscle you have, the faster your metabolic rate. Your metabolic rate is how many calories you're burning just to, sustain yourself. So you need sugar to sustain those calories to make energy, in part, some of it. So the more muscle you have, the more energy you need to you're making, the more glucose you need to fuel that muscle. So that's why strength training is really important if you're trying to reduce blood sugars from like a long-term standpoint, aside from just weight loss indiscriminately. Increased glucose reabsorption. So some of us may have some kidney filtration issues going on, or increased lipolysis, just higher body fat accumulation. So these are the 8 core reasons metabolically that can impact blood sugars rising. Neurotransmitter dysfunction, you also want to think of like stress and cortisol in there as well. Taking control of our blood sugar is important. Why is that? In the short term, life is short and it's meant for living. If every day at 2, 3 o'clock, I get this energy crash and it's affecting my productivity or my mood, that's, an hour or 2 hours of your life every single day, right? Like life is short. We want to get the most out of our time. So of course, helping with energy crashes, helping to manage cravings. So if I go too long without eating and my blood sugar is taking a tank, and my blood sugar is tanking, I'm going to be craving sugar because it's the fastest unit of energy that my body can use to raise those blood sugars up so that I can function like a metabolically healthy human being. So cravings are driven for a reason sometimes. Brain fog, right? So these blood sugars, ups and downs can impact brain fog. And like I said, potential mood swings. Long-term effects, we've already gone a lot into this, but Kidney disease, like chronic kidney disease, kidney failure is linked with diabetes, heart disease, Alzheimer's, and nerve damage. And also, diabetes is one of the leading causes for amputation or reasons for amputation in this country due to infections that don't heal because the sugar is so high that the bacteria just feeds and feeds and feeds off of it. So it's really scary. It can escalate, as we know. So prevention and reversal. Changes can really help to make a dent, especially when we catch the signs early. So in summary, we're going to get more into the nutrition, but optimizing treatment. Diabetes is complex, but if is a complex disease with many different roots. So if left untreated, it can cause a manifestation in many different ways, as we've said. We all need to be looked at as an individual when working with our providers, especially in understanding why our blood sugars are going high. Lifestyle modification is the cornerstone of treatment, no matter what. So even if someone does go on a medication, whether it is a GLP, a GIP medication, insulin, metformin, lifestyle modification is still always ideal to couple with those medications. Being placed on a medication, though, does not mean defeat. I've worked with so many individuals that they're just struggling, and then they get put on a low dose metformin, helps them to really get over that speed bump of insulin resistance, helps to get that sugar into the cell. They get the weight down, they get the stress off the body down, and some I've had get weaned off of it. I've had some that stay on it, but then they maintain a healthy weight, and that's the only thing that they're on is a little low dose metformin. So many times you can, if you're intervening early enough, do this without medication, which is wonderful. But if, progressed long enough, going on a medication does not mean lifestyle fail. It just means you got to do a little bit of both with it, but you're still going to mitigate how much more this could progress and potentially build to. Changes in diet, sleep, stress, weight loss, and increases in physical activity or changes in our physical activity regimen, I should specifically say, can help, of course, prevent going on some of the medications or help to couple with them to, impact lowering the A1C. What is hypoglycemia specifically? It's when blood sugar goes below 70. So how can you tell? Sometimes it's like a clammy sweat or a fast-paced, thready almost heartbeat, feeling a little shaky, almost like a little anxious because the body wants you to feel anxious to go out and look for food. Hungry, of course, we want glucose, right? Anxious, like I said, dizzy, right? I'm feeling woozy. I'm not getting, the energy I need. My body is starting to prioritize energy in other areas of my body versus others. Headaches, right? Because the brain runs off glucose. So now the brain might start needing to shift energy systems off to ketones. And of course, anxiety comes nervousness. So sometimes you might be feeling this kind of way, especially if you start seeing a blurry vision. Black is usually dehydration, so you want to check in. Is it my blood sugars? Am I dehydrated? What's going on? And if you are especially below 70 or feeling any of these, you want to try to get a really quick carbohydrate in. So I know this sounds like opposite world, but this is where you take like a swig of some juice, or you take a fruit leather, or you take some clementines and you suck some of the juice out of the clementines. That fiber is going to slow down digestion. But you want something quick. What is hyperglycemia? So hyperglycemia is going to be the opposites when blood sugars are going above 180. So it's the sugars are elevating, but it's not entering the cell often. So the person might feel more thirsty or an increased need to urinate because the body now needs to get that sugar out of the bloodstream because it's just pooling and pooling and pooling. So the person just has to urinate and urinate and urinate. Also, it's tied with a UTI because now there's more sugar in that urethra and in that urinary system. So then, therefore, it creates more of a place for bacteria to grow. Fatigue, blurred vision, slowed healing, like we were talking about earlier, is all linked with hyperglycemia. Numbness because the nerves are now affecting the transmission, the sugar is now affecting the transmission of the nerves. And what can cause it? Excess sugar intake or a lack of insulin, infections, stress can all up this. So physical signs of hyperglycemia can be dry mouth as well. increase thirst, increase hunger because you want to eat a lot to get that sugar into the cell, even though that sugar is going up, up, up. So often people who have mismanaged type 2 diabetes for a long period of time might lose weight first and then get diagnosed and then gain that weight back because now their body was not able to really absorb any sugars. But they lose a lot of muscle. It's not done in the right way when that happens. So sometimes people will lose weight when first diagnosed with diabetes. So it's not always linked with weight gain or eating too much carbs. That's also a myth. But carbs do affect it. I don't want to say they don't. So signs of diabetes, like I was saying, these hyperglycemia and signs of diabetes are very similar. Of course, diabetes is going to be a longer progression. Hyperglycemia could be a one-time thing, or diabetes is that hyperglycemia has been going on now for a long period of time. So the unexplained weight loss or weight gain, always thirsty, always hungry because nothing's getting absorbed, numbness, high blood pressure, right? There's a lot of extra molecules in the blood to have to pump through, eye damage, frequent urination, and sexual dysfunction as well. Candida, gut health disorder, disturbance. Sorry, I went backwards. So knowing your numbers. So fasting blood sugar should be first taken in the morning, nothing but just water in your body. Postprandial blood sugar is taken 1 to 2 hours after meals. A good goal is for it to be under 140. However, 180 is a cutoff for diabetes. Continuous glucose monitors, or you'll see abbreviated CGMs, help to identify patterns in real time. Some can run on average 10 to 20 points above what your actual fasting blood sugar is. So you want to treat it that you're trending the curves and seeing what ups it and what lowers it, but you don't want to treat it as exact numbers. So sometimes people will double check the monitor and do a finger prick if they think they're way too high or way too low from a safety standpoint. A lot of times you're using the CGMs just to note, I go higher at this time, especially in response to this food. And the person typically knows it's going to run 10 to 20 over about what they normally have. So they just need to factor for that. Ketones in diabetes. So if glucose is really high, you can see someone urinating glucose in the urinalysis or ketones. And of course, the other number that we wanted to know more about is hemoglobin A1C. So everyone should be checking their A1C, especially if over the age of 40. An honorable mention is if you do have prediabetes and often insurance doesn't cover a CGM, a continuous glucose monitor, until diabetes is considered, out of control, which is greater than 7 A1C. Out of control, meaning now it's really likely to be causing damage in the tissues. If the insurance isn't covering it, unfortunately it's out of pocket, but I do believe it's HSA, FSA covered, is the Stelo, STELO. I put a link below. It's run by Dexcom, and you can order it and have it for a month. You want to pay $80 out of pocket real quick. If that's within your means, everyone's in a different spot, and you want to wear that and work with your registered dietitian if they handle blood sugars, just to learn your body's response to different carbs. Is it 100% necessary for everybody to get to that point? No, we could talk about glycemic index and all the foods that we're going to cover in a minute. But if you're someone that's very data driven and you like instant feedback like that, the Stelo can be a great tool for a month to 3 months to help really create some good habits. But again, it's not a must do if you're trying to control your blood sugars. So some goals, right, for diabetes and blood sugars if you are checking your sugars. For people with diabetes, before breakfast, we want blood sugars ideally under 130. You know what? Under 100 is considered like within normal limits. If someone's blood sugar fasting is under 100, it's a very healthy place to be. So a diabetic between 70 and 130, especially if they're being controlled with insulin, you want to be within that range. Ideally under 100 fasting is what would be ideal from a functional standpoint. A diabetic fasting starting to go above 130 though should be a little bit of a flag just to be trending that and then focusing on trying to get that lower, of course, with your dietitian or provider. Before lunch, or you call it supper and snack. So it's after you had had a meal fasted, but you didn't just recently eat, right? Should be under, as a diabetic, under 130, under 110 as a pre-diabetic. 2 hours after meals is under 180 for a diabetic, under 140 for a pre-diabetic. Bedtime, under 150 for a diabetic, under 120 for people without diabetes or pre-diabetic. Of course, you want to look at your own individual trends. And ideally, like we were saying, from a functional standpoint, you really want to try to have your A1C under, 5.3, 5.2, 5, 4.9, great places to be. So cortisol and blood sugar, it's a two-way street. So what do I mean by that? So cortisol can raise blood sugar without eating. So part of this is why we don't want to have caffeine too much on an empty stomach. When we wake up in the morning, as you could see to the right, this is an example cortisol curve. Our cortisol is going to spike high for what's high for us in the morning in an ideal situation, right? That cortisol pushes blood sugars to be released because you want to think of yourself either you're in that fight or flight position or you're in that rest and digest mode, right? Between parasympathetic and sympathetic nervous system. So if you're in that flight or fight spot, sorry guys, your body needs sugar to move and run. So when cortisol goes up, it tells your body to release glucose or to prepare to make glucose through the process of gluconeogenesis, which is just to break down muscle actually or protein to make glucose. So sometimes you can elevate your sugars without necessarily eating sugar directly. So sometimes this happens with coffee, as it can spike your cortisol a little high for what's higher for you and cause potentially those sugars to raise a little bit more. Of course, when sugars raise a little bit more and cortisol is up a little bit more, it's going to it's going to create more of a likelihood for storage of body fat around the midsection because that liver has more sugar it has to filter. So it's going to create more of that fatty tissue buildup around the midsection and the organs and more of that likelihood to create a visceral fat. So you want to think of it as higher cortisol or higher stress, higher glucose. There's higher insulin spikes, blood sugar crashes later, and can affect mood swings and fatigues throughout the day. So we'll get more into that in a clearer sense. Cortisol follows a daily rhythm, so it should start to spike highest in the morning when you wake and then taper out gradually throughout the day, especially before lunchtime, before noon. And then you want to see blood sugars steadily start to rise a little bit after you eat to give you energy, but you don't want too much of a spike that will crash you down. Higher cortisol can create a higher constant glucose dumping into your bloodstream and create a higher need for your insulin to be released by your pancreas. So it can increase that likelihood of stressing the pancreas, needing to work harder to secrete that insulin. Over time, like we said, this leads to insulin resistance and that greater belly fat accumulation or greater risk for further metabolic dysfunction like hypertension and heart disease. And it's not often in the ones in individuals, that say, oh, I'm snacking on all this on these sweets. Like, no, it's not often that we're seeing such high, portions or certain things. It's often people who are burnt out, professionals, maybe over caffeinated, underfed, not, sleeping enough. Maybe they're underfed and then having a few sweets here and there. But often you see it in people who are also chronic dieters who might have that lower muscle mass too, or over exercisers, as over exercising can also increase your cortisol and increase stress on the body and blood sugars. Part of this, though, too, you want to think of cortisol can impact your thyroid. So if you're pushing too much cortisol, it tells your body that we're not in, a de-stress space. We're in that fight or flight. So it reduces T4 and T3 conversion. So it's going to slow down that metabolic rate. It's going to slow down that rate of the thyroid, which is what controls the rate of most things in your body, creates that lower energy. Higher insulin's also produced with more androgens, especially in the case of PCOS. So when someone's very stressed and pushing a lot of cortisol, You also might see dysfunctions with the pituitary releasing LH and FSH, which can affect the theca cells of the ovaries, especially if you're seeing insulin levels rise. If insulin levels are higher, it changes the theca cells of the ovaries and can impact the testosterone and make testosterone rise a little more, impact egg quality or the follicles within the ovaries and make them smaller. So insulin then, if it's causing that increased testosterone, now that liver has to filter that testosterone and that blood sugar. So now the liver gets more stressed, the body gets more stressed, there's more sugar, more insulin being secreted, and the web kind of goes on and on. We could do a whole conversation about that mechanism for PCOS, but that's part of how it impacts that. Acne occurs when you see more androgens like testosterone, DHEA, irregular cycles. So the cortisol and the blood sugars can have a trickle-down effect on sex hormones, especially in women. It also can impact testosterone in men. Mood swings, right? Sugar crashes can lead to irritability, panic, fatigue sensations. Stable glucose can support serotonin and GABA production, which allows your body to literally have that feeling, that relaxation feeling. Magnesium also can help that GABA production. Uh, Sleep disruption. So when blood sugars drop at night, cortisol levels can start to spike. Midnight, in the middle of the night, not midnight, sorry, usually that 2, 3 a.m. wake up period, right? Solution is to consider maybe a balanced bedtime snack, or think of this as like a reverse intermittent fasting, cutting off eating somewhere between 2 and 4 hours before bed, depending on your schedule, routine, and needs. Insulin and melatonin. Melatonin rises in the evening so that your body can start to prepare for sleep in accordance to your circadian rhythm. Melatonin lowers glucose tolerance. So eating late can equal, a poor sleep and higher fasting glucose. So timing before bed is really important, especially that's when your body needs to be resting and digesting. So if we're eating before bed, we're asking our body to work when it's time off, and our body needs to set a boundary. I'm not kidding. But seriously, though, the body needs to rest. So if the body's digesting when it needs to be resting, we're lacking plenty time. We're lacking time where we could be recovering, and then that can be stressing the body too. So inflammation connection, glucose spikes can increase oxidative stress, like we talked about. Glucose inflammation can also disrupt leptin and ghrelin, which impacts our cravings. So, long story short, blood sugars can impact everything, and it's very important to focus on our blood sugar health, including our hormones. It can impact our kidney health, our heart health, our mood, but that's what nutrition's here for. So this is a pretty flyer we've made in the past that breaks a lot down that we're going to go through today into one diagram. So you want to see it as fire burns hottest at blue, right? Blue is one of the hotter temperatures. So the foods that are on the outside of this ring here are more inflammatory foods. They're hotter, right? Foods that we really should not be having as much. So we're going to treat them as social splurges, foods that we don't have frequently. Then we have the yellow circle. So it's cooling a little bit. So that's going to be, if you're in the starch category, refined starches like breads and pastas, waffles, unsweetened juices. So minimally processed, but just refined, maybe not super fibrous, right? In the starches section, as you go into the red, the center, you're going to see better carbs, like our starchy vegetables, peas, corn, potatoes, sweet potatoes, squash, whole grains, and beans. Oh, sorry. So that's that 1/4 of our plate. So we see this giant circle as a plate, and that 1/4 of our plate is just representing our starches. And from outside going in, the inside's going to have the better foods to choose. The foods on the outside are going to have the less frequent foods to choose. That other 1/4 of our plate should be our proteins. So ideally, we want to try to choose proteins that swim, fly, grow from the ground. Typically lean proteins, not high in saturated fats, that are especially feedlot meat versus grass-fed meats, right? Half our plate, we want to aim for a variety of fruits and or vegetables. If it's breakfast, we typically might lean a little towards fruits. lunch and dinner, a little towards vegetables. Typically, even if someone is a diabetic, it does depend on their personal needs, but most people, I've never really seen an occasion for someone that they can't have 2 servings of fruit per day. So typically 2 to 3 servings of fruit per day is ideal. It's the context how you pair them. So we'll talk a little bit about that. So fruit can be here as that half the plate, or ideally vegetables, especially lunch and dinner, being that your non-starchy vegetables, which make up half your plate, should be all vegetables except for the starchy kind that I said earlier. So your non-starchy vegetables are all vegetables except for peas, corn, potatoes, sweet potatoes, and squash. Squash gets like a little asterisk because zucchini, summer squash, spaghetti squash, they're non-starchy. You could eat as much of those guys as you really want to, depending on your fiber tolerance. But all the other vegetables I didn't mention, say like bell peppers, spinach, arugula, eggplant, asparagus, eat as much as you can tolerate, ideally half the plate or about 2 to 3 cups at a meal. Really get your fiber in, great for gut health. Fats, you see our better fats here and our more inflammatory fats here. We also see some better beverages to choose, and then some ways to keep mindful and intuitive when we're eating. Um, but this is going to be an attachment that gets sent as a visual reminder. We've done presentations just on this diagram alone, but it can just be a nice trigger of a way to set your plate. So typically, with regard to blood sugar management, a Mediterranean diet is recommended. The Mediterranean diet is an anti-inflammatory diet, similar to the MIND diet. So at the bottom, of course, you see movement, community, family meal table as cornerstones. Because it helps us to, get our stress out, and maybe, and also I see it as helping to cope in other ways, get that stress out with loved ones versus maybe I'm feeling stressed and I'm going for this food item that I don't really need just because I'm stressed and I'm cramming on my laptop, but really I want to be out walking or with my friends. So sometimes it's, a coping thing. So that's why at the bottom you see, community engagement, eating with others for so many reasons. From the food standpoint, you might be looking at this, is that such a mixed bag of foods? What's the common denominator on this bottom rung here of the pyramid? You see olive oil, you see beans, you see avocado, fruits and vegetables, olive oil, and a little bit of nuts and seeds. The common denominator is that all these foods are plants, minimally processed, that grow from the ground. So for most, except for like the olive oil, the common denominator is fiber. Olive oil is just the cornerstone food of the Mediterranean diet due to all the antioxidants in it, including oleocanthal. Olive oil is just associated with great health outcomes, including lowering of blood sugars, lowering of inflammation, and reduction in stroke risk, just to name a mild handful. So it is a cornerstone food. Someone should try to have olive oil about a tablespoon a day. I'm not saying to take shots of it like you might see on the internet. I'm saying just to try to cook with it, sprinkle it on your salad, keep it simple. Um, Fish and seafood, of course, you're going to see a lot of lean proteins here. So the Mediterranean diet does tend to prioritize seafood a little bit more. We're really happy though if you're eating chicken, turkey, fish, shellfish, egg whites, that's great. The occasional egg yolks throughout the week, especially if they're pasture raised, organic, free range, much better. More omega-3s, less saturated fat. You do see here, though, poultry, eggs, cheese, Greek yogurt. You're not seeing glasses of milk, right? That's a little spiking of sugars for some. Cheeses, you want to think of like hard cheeses, Greek yogurt, cottage cheese. And of course, at the top, all foods fit, it's just the frequency to which they come in. Red meat and sweets. Med Diet does have wine. You're starting to actually see that get taken off in research scoring of it. So anybody who knows me knows I just think the alcohol is really, it's not worth it. It's something that does spike blood sugars a lot and can also add extra stress on the liver to filter and increase burden having to filter sugars and now alcohol. Ideally, water, mocktails, teas, little espresso is not going to be the devil, depending on your needs. What is glycemic index? The higher the glycemic index, the faster the body can break down and absorb these carbohydrates. This causes the blood sugar, or aka glucose, to raise quickly. And we then tend to get drastic highs and lows in these glucose levels. So saying that some foods, like the high glycemic foods on the right, are going to spike your sugars much faster and crash you down much faster than the low glycemic foods like beans, nuts and seeds, especially proteins. They're going to take a little bit more time to digest and actually get into your bloodstream. We're going to go a little more in depth. The slower absorbing foods, like those low glycemic foods that you see on the left, are going to keep you fuller longer, more satiated, more likely associated with a favorable body composition. High glycemic foods are more likely to impact our blood sugars negatively. So this is a spectrum that can help create a lot of aha moments for some patients. Fiber is a type of plant based carbohydrate. So technically, fiber is indigestible. It's like a little scrub brush that passes from end to end. It feeds the bacteria in the gut, but is relatively no calories. It doesn't break down to glucose, right? So when you think of that, carbohydrates are not the devil. You want to think of choosing better carbs than others just more frequently. So on the left, you're going to see the apple, the non-starchy vegetables, the beans. Then we work our way over to like unprocessed grains and also put like starchy vegetables in that category, right? And then further over is just more lightly processed, lightly processed grains. See it as the fiber is just getting reduced, and reduced as it gets milled and refined into more of like a white pasta or white bread, where that fiber is now stripped out of it and along with its nutrients. Why does that impact my blood sugars, or how does that impact my blood sugars? We'll talk about it. The one thing I like to say though is if I don't eat enough foods on this side of the spectrum, I am going to be craving this side of the spectrum by the end of the day for most people. So that kind of creates an opening to say like you can have carbohydrates and you want to make sure you nourish yourself with enough carbohydrates, because if your body gets to a point where it's saying, please feed me, I am so hungry, your body's going to want to break down the most simplistic, easy to absorb version of that food. Soda versus vegetables is a lot easier to get sugar and ATP out of for your body than a fiber-bound glucose fiber-bound veggie. So here you're going to see blood sugars plotted against time. So the red line is going to represent this end of the spectrum here, the refined, more likely to spike high glycemic end of the spectrum. So it's spiking high. So if I have apple juice or white bread, there's no fiber slowing it down. So I can chug how much apple juice, or I can have how many slices of white bread before I feel full. Probably a whole loaf. Pound of pasta? Probably, right? If I don't have protein with it, fiber, healthy fat, there's nothing to really bind. So it's really easy for the acids in your stomach to dissolve that and break it down. It's a simple nutrient. It already starts breaking down your mouth. Think of it that way. So by the time it gets into the stomach, it gets ripped through by those acids really quickly and passed into that small intestine where the sugars start to rise. So now we're seeing those sugars dump from the small intestine into the bloodstream relatively quickly, spikes us high for what's high for us, crashes us down, doesn't really hold us very long period of time. And say this is like breakfast. Oops, sorry guys, I clicked when I shouldn't have. Say this is breakfast and this is lunch. I'm now starting to get hungry here, right? So I spiked high and now I'm crashing down. I'm getting hungry. It's not going to hold me over till lunch. I'm going to be looking to nibble on something. If I now go from apple juice to an apple or white bread to whole grain bread, calories are the same. What's the deal? The whole grain bread of the apple has a lot more fiber in it, a couple more grams versus the latter. So now those digestive juices in my stomach is going to take a little bit more time to munch and break that down. It's going to stay in my stomach a little longer. I'm going to get fuller a little quickly. I can't polish up a whole loaf of whole grain bread, or a whole ton of apples versus how much, apple juice I could drink or how many pieces of white bread I could drink, because it just is going to take more time, take up more space in the stomach. Because it's taking more time, it's going to take more time to get into the small intestine and then therefore get absorbed into the bloodstream. So you do see a lower and slower spike with this blue line representing those complex carbs on this end of the spectrum. So even if it's the same amount of calories, it's holding me over that much longer, keeping my A1C a lot lower too. But what if I want to do myself one better? I could do apples with peanut butter or a low-fat cheese stick or, some turkey and some whole grain bread, say, you know. So what's going to happen is protein and dietary fat, if you want to think about the chemistry of the molecules, they're structurally very big molecules compared to carbohydrates. So when those acids in the stomach have to break it down, like I said with the fiber, but that much more with the protein and the fat has to really sit and break it down even more, especially if you bind fiber with protein with fat. Now we're winning. We're going to hold that over more. We're going to be satiated for a much longer period of time. And then that sugar is going to take a much longer time to get from the stomach to the small intestine into the bloodstream. So you're going to see a much lower and slower spike. My energy is good. It's consistent. I'm not bringing myself high up here, feeling stressed out and in a little inappropriate stress spiral, maybe when my blood sugar's up here, right? I'm staying low and cool, held over from a long period of time from breakfast to lunch, so I'm not nibbling going in my snack drawer. Keeps the A1C nice and low too, and we're feeling really good. So it could then impact portioning going into lunch because maybe we're not as ravenously hungry. So, like I said, that diagram earlier with all the colors, the blue, the yellow, the red, it's mimicking this USDA MyPlate, or AKA this is Canada's version of it, where you could actually see the foods. So like I was saying, 1/4 of your plate should be protein, 1/4 should be a starch, and half your plate should be fruits or vegetables. We love Canada for this image. The only place where they kind of messed up a little bit is you see the sweet potatoes and the peas. That's going to go over here in that starch section. And ideally you want, if you're someone who's more carnivorous and you have the protein on your plate as is recommended, the lean protein, depending on, everyone's situation, but if you do have that higher protein, depending on your muscular goals, you want the animal protein to be here and you want the beans to be here. The beans still contribute protein, not as dense as, say, the lean white fish, shellfish, depending on your needs, chicken, turkey, etc. However, having the beans on that plate will give you a lot of fiber and also help to boost that protein in complement to, say, the chicken or turkey side. But half that plate should be those non-starchy vegetables ideally. Or, you know what, maybe you grew up like me and I didn't have a lot of vegetables and it took me a little time to get used to them. I started with just putting a little on the plate and then built up my comfort slowly and slowly. So something's, you always want to just compete with your past self. Half the plate can be really overwhelming for some. What is considered a serving of carb and how many should I consume per day? So one serving or exchange is different from a portions, right? So that could be, that's typically in terms of 15 grams of carbs. So before Chronometer, MyFitnessPal, Lose It app, all these digital tracking apps, dietitians were still working with patients to carb count. So you would use something called the diabetic exchange list, and it classified all these portions of different foods into 15-gram intervals. So typically, because of that background, carbs are considered in terms of like 15-gram intervals. So you want to see it that as a snack, the average person typically gets 15 to 30 grams of carbohydrates, about 1 to 2 servings or exchanges, right, in that portion. For meals, it depends on the person. Somewhere on the low end, if they're not doing a lot of cardio, right? It also depends on your output and your needs. 30 to 45 grams is considered like a lower carbohydrate dosage for a meal. Breakfast and some snacks, depending on your fueling for post-workout snack. And then you can aim for typically 30 to 60 grams of carbs during your more active times like lunch. For many individuals, I've been changing this a bit and encouraging more carbs at lunchtime. Dinner time, having, about 30 grams of carbs equivalent to about a half of a cup, 15 grams of carbs equivalent to about, a fourth of a cup, say, fourth to about a third. We've been encouraging keeping carbohydrates on the plate, but not as much in the evening, more so protein, healthy, fat oriented, and still cutting off eating about 2 to 4 hours before bed. But in general, if you like to see it in terms of cups, about a third to a half of a cup If you're a lower carb need person, a smaller person not using a lot for cardio, if you are typically a larger person like a male or doing a lot of cardio, somewhere upwards to about a cup and a half on the high end with your carbs. But again, that's really working with a dietitian to find out what is your unique needs, and that's what we love to do in session is, you know, break it down and give you your needs, your portions, your macros. If you don't have a label, these are just some quick rules of thumb for just general portions for snacks if you'd like to see. Again, this is all going to be distributed. Understanding the food label. Something really important to note, of course, any of us that have looked at a food label or you know, worked with a dietitian in the past and talked about food labels, we want to look, of course, at number of servings and start at the very top. So this container has 8 servings per container. A serving is 2/3 cup. For that 2/3 cup, it's 230 calories. For us, we're talking about carbs a lot today. So I'm going to jump to this carb section here. So you want to keep in mind calories, right? But carbs, your total carbohydrates. So for a snack, you really want to try to aim 15 to 30 grams of carbs. We're lucky a lot of snack foods are already pre-portioned, the serving size typically around there, especially if you're buying a more health inclined food. But again, 15 to 30 grams of carbs per snack. But what's really important to note is this fiber right here. You see that's 4 grams of fiber. And the total sugars here is 12. I'm going to nitpick that a little bit. That you want to see the fiber is greater than 10%. So that's considered a good source of fiber. When you want to know, though, like we talked about earlier, all carbs break down to glucose or sugar, not just this sugar here. So you're going to do 37 minus 4, 36, 35, 34, 33. That means this snack is going to break down to about 33 grams of sugar. That's not something to be afraid of or weary of, but it's just important to note that if I'm having a high total carb amount, but there's a lot of fiber in that food, not as much of those carbs are going to really be broken down to true blue glucose. But again, I don't say that to scare us about glucose, like, oh my God, there's actually 30 grams of sugar in this food. I can't have this. I need to keep my sugar low. No, you need to have sugar. We live off sugar. We'd be sick if we didn't have any sugar coming into our body, but we just want to keep in mind how much is approximately too much and how much is not enough. So again, snacks, about 15 to 30 grams of carbs. For a general meal, think of a range of 30 to 60 for the average healthy person. Lower carb people, closer to 30. Higher cardio people, higher to 60, closer to 60. Some people cycle their carbs. This can become very in-depth. So I do recommend, you know, if you're looking to really get this, you know, specific in tracking how much in each meal, definitely working one-on-one with a dietitian. But it's more so about the quality of the carb and how you balance the meal versus if I have 45 grams versus 55 grams. Like that's so minute. It's just a matter of what's the quality of the food? Is it 10 grams make or break of fruit or vegetables, or is it 10 grams of extra, you know, white rice or just plain granulated sugar? Sugars in general, though, um, if I'm being very lenient, like certain foods, certain dairies, like yogurts, right? You want to try to aim for 12 grams or under. You want to keep added sugars as low as possible. But in general, the reason why dairy gets a little wiggle room is because lactose is a natural sugar found in dairy. Typically, you want to keep sugars less than 10 grams per serving and keep your added sugars for women less than about 26 grams per day, men under about 35 grams per day. I don't like that World Health Organization recommendation because I feel like that's good if someone's going above that as like a good target, but I don't want someone to think like, oh, I have this wiggle room. Like you really do want to just try to keep those added sugars as low as you can. Added sugars, though, can sometimes include um, honey. So you just also want to be smart that, okay, I'm adding honey to my food, but I'm just knowing how much sugar is in that honey. I want to try to keep my added sugars as low as possible. Agave also can count as added sugars too. So just to be aware, it's not just the table sugar. Blood sugar and exercise. So, like we were talking about, the more muscle you have, that's why strength training is so important. You're more metabolically active, not just because that muscle is just sitting on your body, but also if I lifted weights this morning, I'm going to burn more calories today because I lifted weights just even in the after effect because my muscles are just more metabolically active. After meals, though, especially, you know how we're talking about after meals, your blood sugar spike a little high for what's higher for you. If you walk after meals, it's been shown that can help to bring blood sugar levels down 10 to 20% or more. And what a great way to help ease into a better night's sleep is walking after meals, bring those sugars down, especially if you're one of us ladies that might be waking up in the middle of the night. That post dinner walk, that strength training, timing your meals, that you're getting at least 2 hours before bed, kind of fasting. That's not kind of that you are fasting. Sorry, guys, I've been talking for a while, so I say little things. But ideally, that's some low hanging fruit to really hone in on. And also looking at dinner, I grew up in a house where we would have just a bowl of pasta for dinner. And now I look back, I'm like, oh my God, I was giving myself such a glucose load at one time. Like, am I having some protein in that meal? Am I having some veggies in that meal? Is there some olive oil, healthy fat? How balanced is my dinner? But exercise can play a significant role in balancing our sugars. I also see a very indirect link where my patients who are active, they're getting their stress out in different ways, some of them, that they're maybe less likely to stress eat and stress nibble, right? If I don't go to the gym, I might have a higher perceived stress for the day and might be more inclined for those little snackings. Um, but something's always better than nothing. So if you walk and it's not after dinner, still walking's good. But if you can time it after a meal, even better. Now we're going to get a little more into supplements. We're not limited to these by no means, but these are just some good common ones to go over in terms of our blood sugar. So B12 or good B complex, right? So sometimes the body, I like to check everyone's, homocysteine, their methylmonic acid, their B12, especially when they're coming in with altered blood sugars or they're on certain medications, especially like metformin, which can lead to greater losses of B12. You want to consider a B complex sometimes over B12, just based on the balance of Bs. Sometimes if you're too high in one B vitamin or too low in another, it can lead to different toxicities. More importantly than that, though, is for some of us, we have different genetic traits that make it hard to absorb certain forms of B vitamins. So often we like to recommend blanketedly the methylated form because everyone can absorb that. But if you want to know more about that, you can test your blood. We do that in session for our patients. We help to give you guys recommendations for what labs would help with this, which would include homocysteine, methylmonic acid, B12, folate or folic acid, B6, just to name a couple. So sometimes your body could be nutrient deficient, and that could be causing stresses on your body too. So we do like to look for that. Coenzyme Q10, it supports energy production in the cell of your mitochondria and has antioxidant properties, especially if you're an individual with high blood sugars, diabetes, and you're also on a statin. You definitely want to consider this for those on statins at higher doses, especially if you're getting any joint pains or aches, because they can deplete CoQ10, and that's what typically causes those joint aches and pains, typically at higher statin doses, though. Fiber supplements, yes, love fiber supplements. I think most of us need them. So the average American gets 11 grams of fiber per day. As women, we want at least 25 to 30. Amazing if we could tolerate 40. I know I sound kind of nuts when you look at how much fiber that is. Men, you want to try to have 35 to, again, 40 and above. The more fiber you can tolerate, the better. That's more vegetables you're taking in, 2 to 3 fruits per day, beans and legumes, nuts and seeds. Not going to get a lot of fiber there, but just some honorable mentions in that plant category. Herbs and spices, right? Very anti-inflammatory. So you get fiber from eating plants. It can be a lot of volume of food and a lot of eating. So fiber supplements like psyllium can be really helpful. Or we do also like the inulin sun fiber supplement that you can put in your water, but try to take it 10 to 15 minutes before meals, especially higher carb meals. Always with water, because fiber, you want to think of it as that little scrub brush that you need to help usher through the intestines. So sometimes if we're dehydrated, it just gets kind of stuck, which is really uncomfortable and can lead to a lot of constipation. If you increase your fiber, and you're feeling some discomfort, there could be a couple things going on, so it's definitely worth talking with your dietitian about or provider. With that being said, though, you want to think of the muscles in your colon as little dumbbells, right? Yeah, like resistance training. The fiber is actually the dumbbells. My apologies. You want to think of the fiber as the dumbbells and the muscles in your colon as like your biceps, right? So if we jump our fiber all the way up to say 30 grams per day and we were at maybe 20, for a while, that's going to be a lot for those muscles to get used to. That's like going from curling 10 pounds to 20 pounds overnight. So you need to build up the musculature a little bit of the colon, allow that to gradually build some strength. It's not a forever thing, but it's not an overnight thing either. So when you're supporting higher fiber in your diet, you want to give your body more water when that does happen, just to help move that through. So start slow, like we said, increase by 2 to 3 grams per day, and gradually, if you can tolerate, 10 to 15. But some good brands could be Sunfiber. I also like Psyllium by Yerba Prima, or believe it or not, Whole Foods. Metamucil also does have psyllium, but there is some smaller amounts of lead in there, more than I would recommend. Consumer Labs also does the lead testing on different psyllium husk supplements, but ground flaxseed, even though it is a fat, also contains lots of psyllium too. So you could treat chia seeds also like a fiber supplement, as about 1 tablespoon is close to about 8 grams of fiber. So another like easy way to intervene with fiber. Ceylon cinnamon, specifically Ceylon, has been shown to be helpful at helping to enhance insulin sensitivity. So I like to recommend put it in your coffee, your tea, cook with it. Some people take supplements if they tolerate it, but just use caution, as it can irritate the gastric lining a little bit, especially of acid reflux. Berberene's a hot topic. It can also help to improve insulin sensitivity. I've had some patients take it at night and report favorable outcomes with their blood sugars in the morning. It is something that you want to cycle for about 2 weeks on or 2 weeks off. It's not something to be on long term, but can be a helpful tool. Some people do about a month on, a month off, but you just don't want to be on it for long periods of time. Magnesium is essential in over 300 biochemical reactions in the body. So yes, this is why magnesium gets a lot of hype on the internet, if you've seen. It does include glucose metabolism and insulin sensitivity. Pumpkin seeds, chia seeds, leafy greens are great sources of magnesium. You can supplement, however, 200 to upwards to 400 milligrams, especially if you're more prone to constipation. If you're also doing a fiber supplement, magnesium citrate can sometimes help as well to help usher that through. Omega-3s. If you're someone who might be more inflamed, again, you can test omega-3s in the blood. We do help to offer this at our practice. Omega-3s, if we have too much omega-6s in our diet from inflammatory, say like seed oils, omega-6s can come from, say, processed fats, think like fried foods, right? Baked goods. It's those more inflammatory omega-6s, if too high in the body in comparison to omega-3s. Think ground flax seeds, walnuts, Brussels sprouts, but especially fatty fish, tuna, salmon, anchovies. Think Italian, think Mediterranean diet, right? Those foods in particular, the marine-based omega-3s are the much better form to absorb. Some people have to eat pounds and pounds and pounds of Brussels sprouts, which would be very uncomfortable and unrealistic, to reach their omega-3 needs. So typically, most people need to eat 2 to 3 servings of fatty fish per week. Think like tuna salad at lunch, maybe having salmon for dinner, or cooking with some anchovies and making an anchovy sauce. But that could help to reduce inflammation associated with diabetes and elevated blood sugars. But like I said, you can have 2 to 3 servings of fatty fish per day. Some really great brands, though. We really like Nordic Naturals, and also Kirkland is very highly ranked. The bottle will say store in a cool, dry place. That's great if your home is temperature regulated, but try to keep omega-3s similar to vitamin D in the fridge. They're both fat soluble, and many of us have to take a vitamin D, so it's great to pair together. Vitamin D is an honorable mention that I did not put in this presentation that I'm regretting at this moment. Vitamin D can impact insulin receptors if low. So I know it seems like everyone's low in vitamin D. Yeah, it's something everyone needs to care about because it can impact a lot of things, including our insulin receptors. Probiotics, like we were saying, the ominous octet, there's all those different mechanisms that can impact our blood sugars. So certain strains of bacteria like Akkermansia is getting a lot of hype right now because it helps to increase those incretin hormones in the stomach that travel up to the brain to say, hey, I'm full. I'm not craving these carbs as much. That's part of the mechanism of action behind these GLP, GIP medications like Ozempic. So you can try to do this naturally by eating lots of fiber to create a diverse flora of the bacteria in your gut, maybe supplementing Akkermansia or different probiotics too, as fiber is also important for a healthy gut bacteria because we need to set that healthy bacteria up with food to stay alive and thrive in the gut. Bad bacteria thrives off of, think of like red meat, sugar, etc. We can also test Akkermansia too, which is interesting. Just to let people know, I don't like to jump to this often in session right away because it is an expensive test. It is HSA, FSA covered, but our GI map test will actually test how much Akkermansia is in your stomach, how much of different bacterial families are in your gut. So that's also something that if you're interested in, to bring up to your dietitian in session or even discuss with your doctor. But you can also look at the gut in that regard too. General recap though, goal for our fasting blood sugars for all of us, for all of us who classify as non-diabetics, under 100. For all of us that non-pre-diabetics, under 100. For all of us that classify as pre-diabetics, we want still always trying to aim under 100, but 124 and below is considered the pre-diabetes fasting blood sugar category. And if your blood sugars are above 125 fasting, that's considered a red flag for diabetes. We would always want to confirm with A1C. Other important lab values to consider, we were talking about our lipids, right? Like our cholesterol, our triglycerides, our blood pressure. We want our factor for cognitive health. We want to check in on our kidneys, just to name a few if our blood sugars are starting to go high. Limit and avoid sugar sweetened beverages and juice. I didn't go so much into that just because I feel like I don't see people drinking soda a lot in session anymore or glasses of juice. I think a lot of people know that by now, but I would be very remiss to not mention that. Just as we were talking about before, soda with that diagram, right? It's a liquid carb, milk at least has some protein in it to slow it down, but soda, juice, it's just liquid sugar that's just going to dump right into the bloodstream because there's not much to really break down in the stomach. It passes right into the small intestine, goes right into the bloodstream, spikes us really high for what's high for us. So I think it's really good to look at those charts. If you're feeling confused about that, I think that's a really important thing to talk about. The protein and or healthy fat with the carbohydrate together helps to mitigate that blood sugar spike. So healthy fats can include nuts, seeds, avocados, olive oil, grass-fed meat or dairy, but really we want you to aim towards avocado, nuts, and seeds. Fatty fish are healthy fats. You want to avoid going too long without eating. We want to try to aim to eat every 3 to 5 hours. So breakfast, lunch, dinner, 1 to 2 snacks. Try to cut off eating 2 to 4 hours before bed. Work with your doctor or RD to determine the level of physical activity best for you. Aim for breakfast. That's a little outdated, no more than 15 to 30 grams. I actually want to take that off. It really depends on your personal needs and how active you are in the morning. But if you are spiking very high for what's high for you, you can do a lower carb breakfast, but have carbs, don't not have carbs. Lunch, if you're more active at lunch, let lunch be your bigger meal of the day. Dinner, we're typically less active, so you taper those portions down a little bit. But typically, if you stick with that plate method we went over, you're going to be in a good spot. Aim for snacks, 15 to 30 grams of carbs. Meals will vary, but somewhere between 30 to 60 grams of carbs per meal is a good range. Do pay attention to your portion sizes. do increase your physical activity. Do not avoid fruit or other healthy carbs like vegetables or beans or whole grains. Do not rely on sugar substitutes solely like Splenda, right? Because it makes us more not addicted, but looking for that sweet sensation, right? Getting that dopamine hit from that sweetness, that sometimes people look for that sweetness in other things, and it can make the sweetness of other foods like fruit taste less sweet. Do limit intake of added sugars to single digits or portions. Manage your stress levels. Do not try to exercise off a poor diet. I've seen so many individuals just doing HIIT class. Like, there's a time and a place for like an Orange Theory or berries and things like that. But if we're doing that 5, 6 days a week, that's not helping us. That's hurting us, and that can really deplete our muscle too. So you also want to look at how much activity am I doing, and some people can actually overdo it. So it is an important talking point with your clinician, especially if the body is very stressed. You do not want to intermittent fast by skipping breakfast, for example, right? If I skip breakfast, I'm just going to be so hungry come lunch for most people I do work with, and it can lead to not the greatest options, maybe at lunch or dinner, and playing catch up with your protein. Keep it simple. Breakfast, lunch, dinner, 1 to 2 snacks. If you're going to intermittent fast, see it as reverse intermittent fasting and cut off at night. How do I find out if I have type 2 diabetes? We talked a lot about this, but a big drive home point is, especially if your blood sugar, your A1C is above 6.5%, or you're seeing that 125, 126 and above. So 1 in 3 people do not realize they have prediabetes. Getting that A1C checked is becoming much more available. We also offer this at our practice. So if your A1C is creeping up or it's a 5.7 and above, it's really warranted to intervene. So of course today was part 1 of the presentation. So we had to really lay the foundation with blood sugars and food. Part 2 is going to be a little more streamlined now that the main foundation has been laid. But we're going to go into what are these GLPs or GLP and GIP medications? How do they work? If I am on them, how do I prevent common side effects, fatigue or nausea? Are there targeted nutrition strategies? Yes, there are, to mitigate muscle mass and help to protect gut health and other metabolic markers. So if someone is on those medications, you want to learn how to best support your body so that we're not just losing weight indiscriminately, but but we are focusing on maintaining. If not, we could build hopefully muscle mass while helping to reduce body fat as needed for the person. So it's not just, losing the weight, but it's about preserving, if not building the muscle, as we've talked a lot about today. That muscle being that metabolic motor. The more muscle you have, the more sugars you're burning right now to keep yourself alive. So that's a really important take-home point. It helps to maintain the weight loss. So when people say I lost weight and my metabolism is so slow now, what they're saying is I lost weight, I lost a lot of muscle, and now I can't eat as much because I don't need to fuel as much metabolic tissue to sustain and keep it alive. So more muscle you have, the more calories you need. We're going to talk about mood and sleep and energy levels a little bit more too. Hunger, fullness cues, food noise, we're going to touch on as well, and other areas of meals to help, sustain us throughout that time. Does anyone have any questions? So I do want to thank everybody for their time tonight and for sitting in. I'm jumping back into the Zoom. Ooh, there we go. And for sitting in on today's presentation. So what's going to go on right now is I'm going to let this video process on Zoom, upload it and edit it on YouTube. And then once YouTube is done processing, which is usually before the night, usually within an hour, I can send out an email to you guys just with the PowerPoint slides, the recording, and